As provincial governments plan for the reopening of schools this fall, a new review from McMaster University says that children are not the super spreaders that they may have thought if they returned to class. The review looked at 33 studies from around the world, focusing on the role of daycares and schools in COVID-19 transmission. Experts agree more research needs to be done on schools, but that young children are not a major source of the virus spread. With more on this, I'm joined by Sarah Neal Stramko. She's an assistant professor at McMaster University and one of the authors of the review. Sarah, good morning. So glad you could be with us.
Great. Thanks for having me here today.
So this kind of flies in the face of what many people thought, that children were these so-called super spreaders, but it doesn't look like they are a major source of transmission. How come?
That's a great question, and I think it's something that we don't really have the answer to yet. With COVID-19, we're having new information come out almost on a daily basis. So I think really the understanding of why this is the case is something we're still going to have to keep looking at moving forward. But what we do see from reports around the world since the pandemic has begun, both prior to lockdowns and in schools that have reopened since lockdown, we see that young children are not a major source of COVID-19 transmission. And when we have seen clusters of outbreaks, the infections in children are more likely to be traced back to adults in the community or home setting rather than from children in schools or daycares.
That's really interesting, considering how teachers are rightfully concerned about getting the virus from kids, but in fact, it might be the other way around.
It might be. So I think this tells us something to keep in mind as schools do reopen in certain jurisdictions, making sure that for the teachers or parents that are coming into the school setting, that the other public health measures that we know work, like physical distancing, hand hygiene, mask wearing, those types of measures should be considered as we move forward to reopening these schools.
Are children, I don't know if the study looked at this, but do they see the same symptoms? Do they feel the symptoms the same way as adults?
We didn't look at that specifically in our review. I know there have been other reviews that does seem that children tend to have milder cases, but that's not something that we looked at specifically in the context of schools and daycares.
What do you think this research means for schools reopening in September?
Well, I think it gives us a little bit of comfort that schools and daycares have reopened in other settings successfully, but we have seen reports from places such as Israel that have seen outbreaks after reopening. So certainly schools and daycares aren't immune from outbreaks, but we can keep certain things like physical distancing, hand hygiene, mask wearing for the adults and teachers in the school settings in particular. And we will keep monitoring this research as more continues to evolve. We know that more research is being published related to COVID every day. So our team will be staying on top of this and reviewing the new research that comes out. But I think it gives us a little bit of comfort to know that children are much less likely to be super spreaders than adults are in other similar congregate settings.
Sarah Neal Stramko, thanks so much. Sarah's an assistant professor at McMaster University.